Well, right now we're at the bottom of what we would call our surge. Now, when I talk about surge, what that means is the maximum number of cases that we'll be presenting to hospitals in a particular area, and we're seeing that in New York. So we're used to seeing on the media all of the tough things that are happening in New York and the Eastern Seaboard, and we could expect to see the same thing replicated in many of our regional big cities on the coast. Now in Utah, we have more and more cases. I think in the state of Utah, we now have over 600 and some cases that have been test positive. We've had 5 deaths so far, but we've got a couple of months to go. We're going to have to take our time and really work on the measures that make a difference. We talked about those on previous Facebook casts. That's physical distancing, which is the term you use, and I like that very much. We need to self-isolate. The schools are closed. Businesses are shut down, unfortunately. That's very difficult on people's pocketbooks and livelihood and their ability to pay for things that they need in life. But at the same time, if we want to really manage the number of cases that become positive and slow the spread, we're going to have to practice physical distancing and staying in place, especially for people who are older, people who are at risk. And so it's going to be a marathon and not a sprint, as we've talked about before.
I guess what I'm afraid of is we're going to start seeing some numbers go up, and we're going to start thinking the things we're doing aren't working, right? The physical distancing, the washing the hands, keeping your hands away from your face. But we know that it is working.
I think we know that it's working. I think there's pretty darn good evidence that what is being done across the country progressively, shutting down, having schools let out, colleges let out, having people stay at home, having people avoid large gathering spaces, closing down sporting events, and unfortunately even leaving work where people are working closely together and moving towards telecommuting and doing those sorts of things, even though that's new to us. That is slowing the spread, and we are seeing that. And our situation is not the same as it is in Italy, where all those poor citizens are really suffering from a surge that they were not able to control. We're also seeing the same thing play out in Spain. Germany has been better at the physical distancing and being able to sort of separate citizens from each other and from employment, and we're seeing lower numbers in Germany right now. So if you look at the EU, it would appear that Germany's able to make an impact, and we're seeing that here. I think what we're seeing in Utah is the evidence. As we drive to work each day, we see fewer cars on the road, many fewer cars. My commute is faster than it's been in years, right? So
because you're essential personnel.
So people are taking this seriously, and it does make a difference. It is making a difference. And what we can say is that the number of cases we've seen here at University Hospital has been stable over the last week. So it's a bit strange. We would think that there'd be more and more cases. A doubling time would be shorter, but it's not. And I think that's because citizens are taking this to heart, and good for them. And even in times when they're putting prevention of this illness before economic means.
Yeah, and I think the other thing too is this is the thing that goes on in my brain, and I know that it's my weakness. I'm like looking at the cases in Utah and I'm waiting for this thing to happen, and I'm not seeing it. So then I think, well, maybe we're just special here in Utah. And then I notice I start getting a little lax, which I don't want to do. When is this surge coming? And are things going to be quite a bit different?
Right, so there's the epidemiologists, they're the scientists that study the spread of diseases and how they peak and how they recede. And basically there are different models, there are a number of different models. But what I can tell you is that if we follow best principles that we just discussed, we might see a surge sort of in the latter part of April, okay? And if that occurs, then we'll be on the downside, it'll be slow, and the slowness also allows us to have enough resources in healthcare to take care of people, to really help them. So again, back to this idea about it's a marathon, and in a marathon you have to think about the next mile, the next mile, and the next mile. It's not just running 2 laps around the track, right?
And I know that we repeat it so often, but it's just so important. Wash your hands like you just chopped jalapenos. Keep your hands away from your face.
Keep your hands away from your face. Basically, some people may wonder about masking. You see a lot of pictures of people in China with masks. We're not at that point yet. More to come out from the CDC on the importance of masking. But if you wanted to wear a mask in public, that's okay. Go ahead and wear one. If that makes you feel better, great. You should do that. You should do that. Don't be afraid to wear a mask. Be sensible. Don't stand close together in lines if you have to go to the store to buy food. Sometimes the stores will let in 10 people at a time. Okay, maintain your physical distance even in lines, and protect yourself that way. So,
we're talking with Dr. Tom Miller. He is the Chief Medical Officer here at University of Utah Health, taking your questions on this Facebook Live. By the way, a great resource to have a lot of your questions answered, a lot of the basic stuff, not only about COVID-19, but also about some of the procedures here at the hospital, what to do if you suspect you have it. You can find at healthcare.utah.edu/coronavirus. One of the questions from Facebook: I have a surgery on Friday. I'm scared I might get COVID-19 at the hospital. Is there a chance? Should I not worry?
There's a chance that you could get COVID-19 in the community, and there is a slight chance that you could always get COVID-19 in the hospital. However, I would tell you that we have locked down our facilities in terms of the protective equipment that people are wearing. We disinfect surfaces constantly. We practice physical distancing. When we are seeing patients as employees, we are wearing the prescribed protective equipment. That would be gloves, masks, goggles for anybody who has COVID-19. We are limiting visitors. We have a very strict visitor policy now, as do other hospitals in the area. So I would say that you have a small risk by coming into the hospital, but I would tell you, in your lives on the outside of the hospital, you need to practice all of the things we just talked about, because your risk is still prevalent in the community.
Yeah, and I should say that, I mean, that's what surgeons and doctors and surgery rooms do best, is they make it the best environment possible.
Right.
So.
Right. The other thing we're going to be moving to in the near future is temperature checks on visitors that come into the hospital, so that we know if they have a temperature that they will be asked a few questions and maybe not be admitted to the facility, or patients if they have severe symptoms. So we're watching that very, very closely, and we're implementing different techniques on an ongoing basis to really push down the incidence, the possibility of contracting COVID-19 in our hospital. It's very important to us because we have to keep our healthcare workers as healthy as possible to help you in the public if you need us. So it's super important for us.
Taking your questions, just to go ahead and put them in the chat area. Can COVID-19 be spread from clothing?
It's possible. There are very few studies on this. If you look at studies of COVID surviving on glass surfaces, metal surfaces, plastic surfaces, there are various lengths of time that the virus stays viable. Clothing has not really been studied. The closest I could possibly tell you is cardboard probably holds COVID virus for 24 to 48 hours, and then it's no longer viable as an infectious agent. But what I would tell you is, if you are if you're a healthcare worker, especially, you bring your work clothes, you change into your work clothes. When you leave, you dress back into your clothes that you're going home in, and you take your clothes home in a bag, your work clothes, and you can wash those.
Yeah.
And so that's a good way to think about clothing.
For healthcare professionals.
For healthcare
not
professionals.
Like a guy like me.
Right.
Yeah.
Right. Right.
And then I know some people are taking their shoes off outside. They're concerned they're going to have it on their shoes.
You know, I think that's okay. I think the chance of that is pretty low, but I think that there's nothing wrong with that, as long as you're not obsessing about it. I think you take your shoes off, but again, the most important thing is having hand gel available in your car, so that when you go into a store and you come out, you can wipe your hands down with the hand gel, and then practice not touching your face, and then keep social physical distance. Important
I think
stuff.
sometimes
Hand gels are, I think hand gels are still available, and you can get them, I believe. And if that's not available, soap and water works great. Okay, so you're consciously thinking about where your hands are, and if you're in a store buying products, you go out to the car, you can hand gel on the way home. You get home, deliver the groceries, separate everything out, wash your hands. Wash your hands.
Yeah, I think sometimes we can make things a little complicated, and what we've seen, the real powerful things are washing those hands, not touching the face, social distancing, physical distancing.
Sometimes people will, not sometimes, but there is some sense that if you wear a mask, you won't inadvertently put your finger on your face, you'll touch the mask, and that's an incentive to keep your hands away from your face. And it also would keep your hands from your mouth, where if you did have the virus on your fingers, it could be inoculated into your body.
Okay. Got another question from Facebook here. If you have one, be sure to type it in the bottom. My medically compromised son's been wearing a mask with me. only out for necessary outings. What can I use for a liner in home to protect him? In a homemade mask to protect him, excuse me.
For when he, was the question when he goes out? When he's outside or just in home?
Yeah, so my medically compromised son has been wearing a mask when with me, only out for necessary outings.
Oh, I see.
The mask
Okay.
is worn out. What can I use for a liner in a homemade mask to protect him?
That's a tough question. I'm not sure that you can purchase a liner that is appropriate to preventing droplet inhalation. I think that's tough. What I would say is, again, your best protection is the physical distance and the hand washing. And I think if he can wear the mask that you've made for him at home, that's fine. What I talked about before, just a minute ago, about keeping the mask on so you don't touch your face, or if you touch your face, you remember that you touched your face, and then washing that mask, or having several masks, and then you could wash the mask before you go out. Right? That's a little bit tougher question. I don't think that the public is able to obtain masks that actually protect against droplets very easily now, because those masks are taken up by most of the healthcare facilities in the United States. I would expect in the next month or so that mass production will kick in and there'll be plenty of proper masks available throughout the United States. That's my hope.
Yeah. Another Facebook question. I see my neighbors getting together with their children all the time. What is one thing I can tell them to stop them from gathering in groups? Now, we've got a whole bunch of new social rules, right? I see pictures on Instagram of groups of people, and what are you doing? And then a lot of times I see, well, this was something they took a couple of years ago. But how can somebody be an advocate for these rules that we know work?
Well, first of all, just realize that we're human and our tendency is to gather in groups. We're social beings, and it's a normal response in an abnormal time. And so I think in order to convince people, yelling at them or getting angry is probably not the right response, but continual messaging and trying to reason people through it is the best technique. And of course, with adolescents and the young, they're immortal, and so they have to hear the message multiple times, unfortunately. It's hard to keep kids away from each other. And my heart goes out to all of you parents who are managing a number of children at home, trying to keep them in place. This is super hard work. But again, getting angry, getting frustrated probably doesn't increase the understanding of what they need to do. It's constant messaging, constant reasoning, and that's what we need to do.
Yeah.
We do the best we can. We're not like a country that can follow you with a drone and then isolate you and take you to a different place if you are not paying attention to the rules, and we don't want to be that. But I think using our good judgment, our good ability to communicate reasonably with people, continually joining arms, well, not exactly, metaphorically touching elbows and telling each other to tell others and spread the message of the importance of physical distancing and hand washing and isolation and so forth.
Yeah,
That's the way to go.
And also just remembering that the better we are at these things, everybody, the sooner we can get back to normal, the more lives that are saved, that sort of thing. How about inside my own house? Should I be practicing some sort of physical distancing from my spouse, or is it pretty much inevitable that if the person I live with gets it, I'm going to get it?
That's a good question. It's kind of a difficult question. You can change that up to the density within your own home. So if you live in a home with 3 or 4 children, it's hard. It's really hard to do that. So again, if you're in a position in healthcare where you could be exposed, some people, some physicians, some healthcare workers are distancing themselves by going to another place to live until they're over this. That's not really a possibility for a lot of people, and I don't have an exact answer. In your own home, you continue to message the importance of, when you go out in the world, when you go outside of the home, of all the things we just talked about. Because once you're back in the home, it becomes very difficult to stay away from each other unless you live in some gigantic home. So I think the important thing is to, again, really get it into everybody's heads that when they leave the house, when they cross the threshold, they're super aware of what the environment is like outside and do all the things we just talked about, because that's the best way when they come home to eat, to sleep, to engage with other family members, that they'll be as safe as they can be.
We're with Dr. Tom Miller, who's the Chief Medical Officer at University of Utah Health, taking your COVID-19 questions. If you're just tuning in, a great resource to check out is healthcare.utah.edu/coronavirus. There's the answers to a lot of basic questions there, including some of the basic stuff we're talking about and some of the hospital policies, that sort of stuff. We've got another question. I'm a healthcare worker who's been taking care of patients who tested positive for COVID. I have a doctor's appointment that is unrelated to COVID symptoms. I've been feeling fine. Should I wear a mask outside of work?
If you're feeling fine right now, there's no CDC recommendation to wear a mask outside of work. I think, again, what we talked about on a previous Facebook interaction was the moment you feel any symptoms, that you self-isolate, so that you don't go to your doctor's visit unless it's urgent, that you stay home, that you let your employer know that you are not going to be coming in, that you then wait to see if the symptoms evolve, and if they worsen, then you need to be seen and tested. Actually, at this point, with our test sites, we have multiple test sites. If you have symptoms, you can be evaluated in your car at one of our 4 sites and tested. So again, for this healthcare worker that's writing in, I do appreciate the concern they have in preventing the spread, but if you're completely asymptomatic, I'm not worried about that, and there is not yet a recommendation about wearing a mask in public. If you wanted to do that, I'd say go ahead and do it. That's great. You can alert your healthcare provider before you go to the visit that you have this particular role and that you are working with COVID positive patients, and then take it from there.
I think that's great. Just communication is so
Yeah, it's
important
just-
between
Communicate,
everybody
right,
at this
exactly,
point, right?
yeah.
Incidentally, if you're wondering what those testing criteria are, you can go to healthcare.utah.edu/coronavirus. And the first thing you're going to want to do is call the phone number that's on there.
Yeah.
You can drive up to those drive-in tests, but it's preferred if you call the phone number first.
Right.
You'll have a short interview and then get the yay or nay to go to testing.
Right,
Yeah.
right.
Another question from Facebook. We just brought home a new baby. How long should we wait before starting to allow family members and others to see her? That's a tough one.
Again, I don't have a direct answer for that. I don't think if everyone's healthy, no one feels the least bit ill, there's been no exposure to someone with COVID-19, I don't think you'd hold back. I think you're okay.
But maybe not get in like real close. Like
That's pretty hard to do with new babies. Maybe not. Maybe you put a plexiglass shield between the. No, I'm just teasing. So no, I think if everyone's healthy, I think again, it's communication. You do a check. Whoever's coming to see the baby, grandmother, grandfather, are you healthy? Do you have any symptoms? Are they going to wash their hands before they pick the baby up? Maybe you don't want them to hold the baby, but if they do, and a lot of people, they're going to wash their hands. Maybe they wear a mask. Although again, there's not a recommendation to do that. A new baby is a pretty proud moment, is a pretty exciting moment for everybody. Again, I just do the background on whether everybody's feeling well. Maybe you have one family member at a time come in and look in the bassinet and say goo goo gaga, and that's great, and then they go back out. So that's my answer.
And ultimately,
Yeah.
I think we all need to do the things that we feel. So if, as parents, they decide that maybe I'm not comfortable with this, they're again,
speak up. It's okay.
that.
Communicate it. It's okay. You're going to be right if whatever you decide, you're going to be okay.
Is COVID-19 airborne or droplet? I see people go back and forth on this topic. I think this might be
That's a good question.
To
So
talk about how it's spread, how it.
Yeah. So again, it's spread in 3 ways. One is through contact. So when droplets land on a surface, and that's why we talk so much about hand washing, you can pick them up on your fingers, and if you inadvertently touch your face, then it gets into your mouth, nose, or eyes, and that's how you would become inoculated. The second way is from the direct inhalation of the droplets. So when someone sneezes, the spread of this virus, as with other viruses, including the flu virus, rhinoviruses, common cold viruses, they're spread by droplets. So you sneeze, and that's why we talk about the 6-foot distance from somebody. The droplets usually don't make it beyond 6 feet, so you're going to be safe there. The aerosolized part is when people are really coughing vigorously, and those circumstances occur when someone is actually under a procedure. So they're being intubated with a intubated for life-saving procedures, being put on a ventilator, and certain other surgical procedures. That is a condition where you get aerosolization. And tuberculosis travels by aerosolization, measles travels by aerosolation. With aerosolized particles, they travel much farther than 6 feet. That's a different circumstance. But for the vast majority of COVID-19 patients, those patients spread it by droplet, and they spread it when the droplets land on a surface and someone inadvertently touches that surface and doesn't wash their hands.
So it's touching surfaces, or perhaps getting droplets from a sneeze if you're close.
Sneeze if you're close, and so we have masking in a situation where someone is coughing, you wear the mask to prevent them from the droplet spread. In a case where there would be aerosolized spread, so if someone was being intubated or there was another procedure, nebulization medical procedure, the physicians, the providers, the nurses would wear specialized respirator masks that prevent aerosolized spread. That's a separate condition. For the vast majority of interactions, a simple procedural mask of the right caliber will prevent droplet inhalation, as well as glasses. So for our providers healthcare workers who are seeing a patient who's possibly COVID positive or known to be COVID positive, you mask the patient, and the provider wears a mask, eyeglasses because the droplets can get in the eyes, gloves, and a gown.
Okay, but if you had it and we're here talking 6 feet away, you're not
Unlikely.
putting that out into the atmosphere for me to breathe in.
If that was true, you probably wouldn't be here, but yeah. You wouldn't want to talk to me, but true. 6 feet away, great distance, droplets don't make it farther than that.
Out exercising, 6 feet away, breathing heavy,
it's
still?
fine. Yeah, it's fine.
Got another question from Facebook. We are here with Dr. Tom Miller, Chief Medical Officer of University of Utah Health, doing COVID-19 Q&A. Again, where are you feeling? Where are you at right now? If you have any questions, any myths that need to be dispelled, go ahead and let us know what those are. Can pets spread this virus to pets of other households and then to their owners? So we're talking from pet 1 to pet 2 in another household to an owner.
That's a tough one. There's a couple of case reports that animals, dogs in particular, and maybe there's just 1 or 2 reports that they can be infected with COVID-19. I don't think we have enough information to know. We take our dogs out on the weekends and we go for walks. They play with other dogs. Truthfully, I haven't thought about it. Maybe I'll regret that in time, but I just don't see them as a transmitter of COVID-19 at this point.
At this point, pretty small chance.
Yeah, we're not.
I mean, again,
not
the core message is hand washing, don't touch face.
Yeah.
6 feet.
Yeah.
Those are the big things.
And I wouldn't say you need to wash your dog after walks. I don't think there's enough information out there to verify that.
Can it be spread by other animals or bugs, mosquitoes, that sort of thing?
Well, it goes back to to the best of our knowledge, no, it's not spread by mosquitoes. I mean, some of this goes back to the original epidemiologic studies in China that looked at the Wuhan fish market, where certain animals we know carry coronavirus, probably may have passed the virus to humans in a mutated form that then allowed human-to-human transmission. And that's one of the ways that flu viruses spread, that coronaviruses spread as they go from animals to human after mutation. Not in dogs, not in cats, not in common domestic animals. We don't have any evidence of that.
Okay.
Real strong evidence. Again, we have a couple of case reports, but in my mind, that's not enough information to put the dog out to pasture. So.
Yeah, I do need to say that hanging out with Dr. Miller, I've learned that you'll never get a definitive no because you depend so heavily on research and what we do know, and as at this point, there just isn't enough evidence to support that.
Right, I don't think so.
Yeah,
I don't think so.
If a family member gets sick in the household, do you have some recommendations on measures other family members can take? They might have to take care of that person. You know, they want to avoid getting sick as well.
Yes, if you can get masks from the healthcare provider, if that's possible. Everybody's holding dearly to their masking inventory, but a homemade mask perhaps, or a surgical mask, procedural mask to put on the person that is positive. then to keep them, if possible, in a separate room, move all their toiletries to that area, make sure you wipe down all the surfaces in the house on a regular basis, and meals would be held apart. And if possible, and if one has the resources, to move that person, if they're mildly ill, to another place, if that's possible. So an example would be, maybe that person would move into grandma and grandpa's home, and grandpa and grandma would come over and stay with the family. Maybe not. Depends on the social situation and the ability. But again, you go to hand washing and masking if you have the ability to obtain masks, and then wiping down surfaces, and then isolating that individual with COVID-19. Very difficult if it's a teenager, and even maybe more difficult with a child.
Yeah. But going in the room, giving them food, that sort of thing, again,
I think it's easier with adults. I mean, adults sort of get it, and you know, they'll say, okay, this is my space, I'm going to stay here. And then they would take meals in the room, and that would be easier. But if you've got a child that's 8 or 9 years old, that's going to be a real tough sell. How do you do that, right? I'll give you some information that came out on an MMW report. That's the Morbidity and Mortality Weekly that comes from CDC. Basically, that document looked at a study recently of 500 individuals in the United States who were positive for COVID. And what it found was there was a 10% chance of spread within a family. So 10%, those are considered close contacts, would become positive for COVID-19. It's not everyone.
Yeah, that's actually a fairly...
Remember, it's one study,
Yeah.
but it's interesting.
Yeah.
On the outside of that, so for infrequent contacts, it's 0.5%. So that's probably one of the reasons we see such low-level infectivity for a long period of time before it ramps up. It's a matter of mathematics, and that's what the epidemiologists do to create their models. But given those numbers, I think we can now start to understand a little bit why this is spreading slowly initially in the community. It's not everyone in the family that gets COVID-19. So that's something that you can all think about. And it's certainly not everybody outside. If you are in contact, when I say, if you're in a store and you found that your friend ended up having COVID-19, if you were only there near them for 2 minutes, it's very unlikely you're going to get COVID-19 from them. It doesn't stop you from doing all the things we talked about. It does give me some hope that people who are living in families may not experience the spread as aggressively as they might think.
Yeah. Our Facebook Live with Dr. Tom Miller. We're going to take 2 more questions, and then we're going to wrap this one up. Again, a great resource is healthcare.utah.edu/coronavirus. A lot of good information there. This question is, somebody that works at the hospital, what happens if a family member gets the virus? Can I still come to work before getting tested, or should I stay home? So a family member gets a confirmed case in the family.
So what we say here at University of Utah is, if you are in contact with a COVID-19 patient, either at work and you're not wearing the protective equipment, or you come into contact with somebody at home or who develops COVID-19, you are completely asymptomatic, you come to work, because we need our healthcare workers.
Mm-hmm.
And again, we're in a changing environment. We have changed our policies from week to week. So what I'm telling you today might change depending on how much testing is available. Maybe we'll go to testing these employees on a weekly basis, or even a daily basis. But we have to wait and see how much testing availability we have. And as things evolve, we'll know more. But at this point, and at the University of Utah, if you're a healthcare worker and you are completely asymptomatic, you come to work.
Okay. Final questions. Are there any medications to treat COVID?
There are no studied and affirmed medications that are known to prevent COVID-19. There are medications that are being studied. Many of you have heard about hydroxychloroquine and chloroquine, 2 medications that do have uses in people with immune disorders like rheumatoid arthritis and lupus. Those medicines are now being studied on the hope that they will help reduce the length of time that one has COVID and reduce the severity of the infection. They are not proven to be valuable at this point, but they're being studied. The University of Utah has 2 studies on the inpatient side, and we have just started, or will start within a couple of days, a large outpatient trial looking at the value of using hydroxychloroquine in folks who've developed COVID-19.
I want to just ask one more question about that. What is the danger of taking a medication like that before a study is out?
The danger is one that it diverts you. First of all, if you're taking it for prophylaxis, which no one is advising at this point, prophylaxis means you're taking it to prevent the illness. That could have complications over the long haul. Neither of the medicines that I just mentioned are benign. They have side effects, and especially in folks who take certain cardiac medications for their heart. So basically, you need to look at the medications that the person is taking prior to giving them treatment. And another disturbing thing that we've learned is that a number of these patients who have COVID-19 who come in and are critically ill develop heart problems. That's one of the things that the virus does. It causes inflammation in myocardial tissue. And those are the folks that you wouldn't want to give these medications to, because they do have cardiac side effects that could be pretty severe and life-threatening. So it's not an easy walk in the park. We are studying it aggressively. We should have an answer, I would think, in the next month or two in terms of the value of these medications. The more people that we enroll in the studies nationally, the quicker we'll get answers. And then we can decide whether either hydroxychloroquine or chloroquine will be beneficial. There are other medications that have been discussed. I don't think those are nearly as valuable. So these are the 2 that we're really looking at now. And really, we're just looking at hydroxychloroquine, not chloroquine. Chloroquine has more side effects than hydroxychloroquine.
Self-prescribing any sort of drug is just dangerous business.
Yeah, I think that's, I think.
Until you know.
Right.
And that's what these tests are for.
Absolutely.
Thank you very much for tuning into our Facebook Live with Dr. Tom Miller, Chief Medical Officer at University of Utah Health. If you need more COVID information, a great resource, of course, is the CDC, or you can go to healthcare.utah.edu/coronavirus. Thanks for watching.
Thank you.